Congratulations on your pregnancy! This is a time of joy, excitement, and a bit of nervousness as you embark on this incredible journey. The journey of pregnancy is an incredible one, filled with anticipation and wonder. Each day brings new experiences and emotions as you prepare to welcome a new life into the world. As you navigate this path, prenatal appointments and scans become your trusted companions, offering glimpses into your baby's development. These moments are not just routine checkups, they are milestones that mark the progress of your pregnancy. One such crucial milestone is the 12-week scan, a moment eagerly awaited by expectant parents. This scan is often the first time you get to see your baby moving and growing inside you. This scan provides valuable information about your baby's growth and overall well-being. It helps in assessing the baby's size, the development of vital organs, and can even give you an estimated due date. It also offers insights into a critical aspect of pregnancy, the positioning of the placenta. The placenta's position can affect your pregnancy in various ways, including the delivery process. Understanding placenta positioning is vital as it can influence various aspects of your pregnancy journey. Knowing whether the placenta is anterior, posterior, or low-lying can help in planning for a safe delivery. This comprehensive guide delves into the intricacies of placenta positioning, empowering you with knowledge and addressing any concerns you may have. It aims to provide clarity and peace of mind during this transformative time. From the different types of placenta positions to their potential implications, we'll cover it all in a clear and reassuring manner. Stay tuned as we explore these important details to help you feel more prepared and confident. Before we explore the significance of placenta positioning, let's first understand the vital role of the placenta itself. Imagine the placenta as a remarkable organ that develops in your uterus during pregnancy. It acts as a lifeline between you and your growing baby, facilitating the essential exchange of nutrients and oxygen. Think of the placenta as a dedicated delivery service, ensuring your baby receives all the nourishment and oxygen they need to thrive. Simultaneously, it acts as a waste removal system, efficiently carrying away waste products from your baby's bloodstream back to your body for disposal. The placenta's function is absolutely crucial for your baby's growth and well-being throughout your pregnancy. Now let's unravel the mystery surrounding placenta positioning. During your 12-week scan, the sonographer uses ultrasound technology to capture images of your baby and the placenta. One of the key things they look for is the location of the placenta within your uterus. This information provides valuable insights into how your pregnancy might progress. The placenta can implant itself in various locations within the uterus, and each position comes with its own set of characteristics. Rest assured that in most cases, the placenta's position doesn't pose any significant concerns. However, understanding the different types of placenta positions and their potential implications can help alleviate any anxieties you may have. Section 4. Anterior placenta at the forefront. One of the most common placenta positions is the anterior placenta. This means that the placenta attaches itself to the front wall of your uterus, facing your abdomen. In this case, the placenta attaches itself to the front wall of your uterus. Picture it as the placenta taking center stage, positioned towards your abdomen, almost like a protective barrier. Picture it as the placenta taking center stage, positioned towards your abdomen. This positioning is quite common and is usually detected during a routine ultrasound scan. An anterior placenta is nothing to be alarmed about as it occurs frequently and typically doesn't cause any complications. Most women with an anterior placenta go on to have healthy pregnancies and deliveries. However, it's worth noting that an anterior placenta might make it a tad trickier to feel your baby's kicks early on. This is because the placenta acts as a cushion, muffling those tiny but powerful movements. As a result, you might not feel those first flutters as early as someone with a posterior placenta. Rest assured, as your baby grows bigger and stronger, you'll start feeling those reassuring kicks, even with an anterior placenta. These movements will become more pronounced and frequent as your pregnancy progresses. Section 5. Posterior placenta, taking a back seat. In contrast to the anterior placenta, a posterior placenta takes a back seat, attaching itself to the back wall of your uterus. This means the placenta is nestled behind your baby, closer to your spine. Like the anterior position, a posterior placenta is a common and generally unremarkable finding during the 12-week scan. A posterior placenta doesn't interfere with feeling your baby's movements and might even make them more prominent. This is because the placenta doesn't act as a cushion, allowing you to feel those kicks and jabs more easily. So, if you have a posterior placenta, get ready for those exciting flutters and rolls. Section 6. Low-lying placenta, a cause for attention. While anterior and posterior placentas are common and usually harmless, there's one more position that requires closer attention: the low-lying placenta. This particular placement can be a cause for concern and needs to be monitored closely by healthcare professionals. As the name suggests, a low-lying placenta implants itself in the lower portion of your uterus, close to the cervix, which is the opening to your womb. This proximity to the cervix can pose certain risks that need to be managed carefully. This position can potentially cause some complications, particularly if the placenta covers or partially covers the cervix. Such a scenario can lead to significant issues during pregnancy and delivery. This condition is known as placenta previa. Placenta previa is a serious condition that requires careful monitoring and management to ensure the safety of both the mother and the baby. Placenta previa can lead to bleeding during pregnancy and might necessitate a cesarean section delivery. This is because a vaginal delivery could cause severe bleeding, posing a risk to both mother and child. However, it's important to note that a low-lying placenta detected at the 12-week scan often resolves itself as the pregnancy progresses. This natural resolution occurs in many cases, reducing the risk of complications. The uterus expands, naturally pulling the placenta upwards and away from the cervix. This movement helps in mitigating the risks associated with a low-lying placenta, allowing for a safer pregnancy and delivery. Section 7. Seeking guidance. When to consult your healthcare provider. Now that you're familiar with the different placenta positions, you might wonder when it's appropriate to discuss your scan results with your healthcare provider. While this guide provides general information, it's always best to consult your doctor or midwife for personalized advice based on your individual circumstances. They are best equipped to interpret your scan results and address any specific questions or concerns you may have. If you experience any unusual symptoms, such as vaginal bleeding, abdominal pain, or decreased fetal movement, don't hesitate to reach out to your healthcare provider immediately.